I'm Brad Krier, South Central Field Epidemiologist with the Minnesota Department of Health. Well, seasonal influenza is a respiratory illness, so meaning it causes things like cough, fever, sore throat, those sorts of things. Now, you'll also hear people call things the stomach flu, and that usually has to do with vomiting, diarrhea, things like that. And that's a gastrointestinal illness or a stomach illness. It's just easier to call it the stomach flu. That lasts about 24 to 48 hours, but it's usually caused by a virus, a norovirus or something similar. But it's not a respiratory illness. That is a gastrointestinal or stomach illness. When you're looking at seasonal influenza, like I said, that is a respiratory illness. So that's really going to affect your lungs. It's going to affect your breathing. You're going to have the cough. You're going to have the fever. You're going to have the tiredness. For the most part, it's a respiratory illness, so it's spread from droplets for the most part. Droplets is mainly 3 feet, so if I'm coughing or sneezing, people within 3 feet of me. There are some smaller particles that they believe can, dissipate throughout farther than 3 feet, so they're saying, 6 feet, maybe even farther. So again, if there's somebody sick in your office or something like that, it can certainly spread pretty quickly. Another thing with it is it can survive on surfaces. Now, a question we often get is how long will it live on the desk, or how long will it live on this pen? And that's really, really difficult to say. There are so many different variables involved with temperatures and direct sunlight and all these sorts of things. But it definitely can live on inanimate objects. So it is something, so when you touch a door handle or when you touch something, and if you, don't lick your hands or eat something, so it is definitely possible to spread that way. But the main way that we do see it spread is from person to person. Those people who are coughing, those people who are sneezing, those people who are sick, and just kind of miserable and are still going out and being around people. Usually symptoms will last anywhere from 5 to 7 days, but it can last, up to 2 weeks, it's kind of depending on, to be fully recovered from it. The symptoms will kind of wane or go away over time, but, sometimes to be back to normal, it takes almost 2 weeks in some individuals. You can treat your symptoms, your fever, your headaches with some of those over-the-counter things. But if it truly is influenza, the sooner you get in to get your antivirals or your medications, the more effective that they will be, and it can actually reduce the length of your illness. So it's better not to wait, especially if there's a lot of influenza in the area. If they're starting to see it, if it is that flu season, that winter time, so anywhere from basically October to April and May, if you're seeing those respiratory illness, that cough, that fever, kind of hits you pretty quick too, it's better not to wait. It's better to get in as soon as possible and try to, again, have a physician see you and see if you do need treatment, and hopefully that can prevent your illness from getting worse. And also, it prevents you from spreading it to others. But the vaccine is still the best thing that we have. When you're looking at protection, even if it's only 60% effective, not getting it is 0% effective. So again, if you're a betting man, you're going to take that 60% over 0% any day. And again, it's not 100% effective. So even people who did get the shot can get influenza and can get sick. Research is kind of pointing to those people are less likely to get severe illness. So even if you do get influenza, even though you got the flu shot, and evidence has shown that it seems to be milder. Influenza shot cannot give you influenza. So it is an inactivated virus, which means that it's basically a virus that cannot reproduce. The flu shot anyways is that if you get the nasal spray, that's a live attenuated virus, that basically means it's a weakened virus. So it will be able to reproduce, but it has the things that make it severe, the things that make you sick are taken out of it. Obviously, with any vaccine, you can't have pain at the injection site. Sometimes you might have a runny nose or stuffy nose, even sometimes low-grade fever, things like that. But they're very mild, especially compared to influenza, which is very high fever, cough, headaches, malaise, sometimes hospitalizations, and sometimes death. even before your symptoms start, you can transmit the influenza. So that's always a concern. They say 24 hours even before your main symptoms start. So that's why we definitely want you to also wash your hands. When you are touching door handles, if you are touching keyboards, if whatever you are touching, it's really important to wash your hands, and not just for influenza, for basically anything out there. But for influenza in particular, when we're talking about that, it is a really effective strategy. Again, covering your cough. So if you do have a cough, when you do start to get sick, to make sure that you cover that up. And then definitely, go home when you're sick. You can feel like you're doing the right thing by going into work and being brave, and you've got work to do, but you also have coworkers who have work to do. So if you go in and expose all of them, then they're sick and they can't do their work either. So you're not actually doing anybody any favors by going to work sick. You're actually, ruining productivity or hurting productivity. Are getting together, and maybe you haven't seen somebody in a long time. So to say, I'm sick, but I haven't seen so-and-so for a long time. Well, especially if you have older family members, they're at highest risk, or they're one of the high-risk groups for severe illness with influenza. So we definitely want to make sure that you're not exposing them. So it's definitely better to stay home and maybe send an email or give them a call or Skype them or whatever to talk to them, rather than exposing them to the germs and possibly, to a very severe illness. Because this could be a very mild flu season, it could be a very severe flu season, and we really don't know until it's happening what it will be. So I think our best plan is to plan ahead. It doesn't really change that much, influenza. I mean, there can be different strains and maybe some different aspects to those strains, but for the most part, the symptoms are going to be the same. How it spreads is going to be the same. So it's pretty much constant that it will be there. It's just how severe it will be. So planning ahead is the best bet. The big takeaway message with this is that nothing is 100% effective. So when it comes to preventing influenza, the main weapon that we have, the best weapon that we have, is really that influenza vaccine. Now, again, it's not 100% perfect, not 100% effective, but even if it's only 60% effective, 60% is certainly better than 0%. So it is the best thing that we have. And we really recommend that you get that to prevent illness and protect yourself and protect your family and protect everyone around you.